Well, we're back at it. EMR, Emergency Medical Responder, Chapter 21. You didn't think you were going to be able to make it, but hey, look where we're at. Chapter 21, final chapter. Moving on. So, introduction. We're going to talk about incident management. So this is a place where you can make a big difference in a critical incident when you have multiple casualties and multiple agencies, and when you get this thing sorted out properly, this can be a real help to people that are responding to this scene. So let's talk about it. So as an EMR, you're going to be able to identify that, or you should anyways, be able to identify the signs of a hazardous materials incident and prevent injury to yourself and to others in the first minutes of the incident. So thinking about that, there is several things that's pretty important for you to understand. One is the purpose of an incident management system. We're going to talk about that. The framework of the National Incident Management System. You see right here, you may hear me refer to that as NIMS. That's what when I say NIMS, that's what we're talking about, National Incident Management System. And then also just some basic triage. This can become a real help as well for those responders that are coming in. If you've done a good job of triaging, then that's going to save a lot of time and really help out the oncoming crews. So you should also increase your awareness of the possibility of terrorism as we're talking about we're talking about incident management. I'm sorry, I had to turn the ringer off my phone. So hazardous material incidents. What hazardous materials are is that they're substances that are toxic, poisonous, they're radioactive, they're flammable, explosive, all these things. And what they can do is they cause injury or death with exposure. So when you have one of these hazardous materials incident, your top priority is going to be to protect yourself and bystanders from exposure and contamination. Hopefully, we've stressed that enough that scene safety is the most important thing that we have going on here. Your top priority is to protect yourself and the bystanders. But listen to what I'm saying. It's to protect yourself first. Scene safety has to be your biggest thought when we're talking about this stuff. So when we respond to hazardous material incidences, some of the things we're going to do, we want to identify the substance involved. So federal law requires that all vehicles containing certain quantities of hazardous material display a hazardous materials placard, and hopefully you're aware of that. The placard should include a 4-digit identification number, which can be used to identify the substance and obtain the information. So you see here, this is what we're talking about, all the different placards that you might see. You'll see numbers, you have classes, all of these different things. I'm not going to go into this because you should definitely go to an awareness class if you haven't already. And in that, they're going to teach you how to use this. You want to make sure you're aware of how to use your emergency response guide. So what we're talking about there is what this does is it talks about lists the most common hazardous materials. It has their 4-digit identification number, proper emergency actions to control the scene when these materials are present, so it's going to let you know what to do, emergency care of patients who become ill or injured after exposure to these substances. So it's a pretty important thing to have in whatever rig you're using. So unless you've received training in handling hazardous material, keep away from the contaminated area, or you'll hear the word hot zone. Stay away from the hot zone. And what that hot zone is as you see right here, is this contaminated area. So as soon as you recognize that a hazardous material incident exists, you want to go ahead and notify the dispatcher so other responders will be aware of the situation. We don't want oncoming crews to have to learn about it as they step in it. So we want to make sure everybody is aware of what's going on and what we have on our scene. Identify victims who have sustained an acute injury as a result of exposure to the hazardous material or the hazmat stuff. Things we want to do with them, we want to remove them from the contaminated area. We want to have trained personnel decontaminate them. There's a series of things and a particular way to do it properly, and that's what we want to do. We want to give necessary emergency care and then transport these people to the hospital. So very few specific antidotes or treatments exist for most hazardous materials. So the main thing that we're going to be doing is going to be giving supportive care. We're going to constantly reevaluate our patients' vital signs, but really importantly, we need to remember about their breathing status. So their respiratory. Are they breathing adequately? Are they moving air? Equal chest rise and fall? Or is there wheezing? All of those things that let us know there's some type of injury either to the airway or the breathing, the respiratory system. So EMRs should receive specific additional training in hazardous waste operations and emergency response, the HAZWOPER, to the EMR level. Mass casualty incidents. So mass casualty incidents or multiple casualty incidents are situations involving more than one sick or injured individuals. So when we say mass casualty or multiple casualty, more than one, that's what we're talking about. Now these things, they range from a number of different things. It can be a serious automobile accident, a building explosion, or let's just be honest, considering we're in Oklahoma and where we're at, it could certainly be a tornado. So that's more than likely going to create one of these MCIs or a mass casualty incident. So what we need to do is we need to first be able to recognize that the situation recognize the situation as a mass casualty incident. So recognize because of all the damage that's been done, or whatever, you see 2 or 3 vehicles involved and you're on I-40 or wherever on some country highway, state highway, that there's multiple vehicles and multiple patients. You need to be able to recognize that and move on to the next thing, meaning getting more additional resources. And these incidents, these require a very different method of operation from other emergency calls. So different things that are variables when we talk about mass casualty incidents. We got everything from the severity of the crash. That's going to be a variable, can be very minor to very major. Access routes, available resources, our response times can be a big deal, especially if we are talking about, say, a tornado, because you're going to have a lot of downed trees and a lot of debris in the road. Levels of emergency training, and then overall experience of the EMS system. If we're just a whole group of newbies, we may have a hard time working our way through these without somebody that's kind of been there and done that before. So your goal when we talk about this, our goal of these mass casualty incidents, it should be to provide the greatest medical benefit for the greatest number of people and to match the patient's medical needs with appropriate treatment and transportation. So this is pretty important. So let me make sure you understand this. What we're saying is, you need to be able to provide the greatest medical benefit for the greatest number of people and also match their needs with the appropriate treatment and transportation. So, whereas if you were in a home with one person, you might do CPR on somebody, on somebody that doesn't have a pulse. But in this system, not so much, because we're trying to provide the biggest bang really for the smallest buck, right? So we want to do the least amount of work and provide the greatest amount of care. We can't get bogged down with one call, I guess is what I'm trying to say. And it's not easy to do. It's very hard to do. So the visual survey, as you're on the way to the scene, prepare yourself mentally for what you may find. Your eyes are going to see everything. So make sure you prepare yourself, make sure you're ready to see what you're about to see, and then ask some questions. Where will additional help come from? You want to make sure they have a route to the scene. And then how long will it take them to get there, because that should kind of give you an idea of what you may or may not do depending on how long it's going to take. So when you arrive at the scene, do your very best. Force yourself to stay calm. It's going to be really easy to get really wound up and allow your emotions to take over. We have to just stay business as usual and just go to your patient assessment and go check your ABCs and all these different things that we do as emergency medical people. You need to be able, that's what we need to do. So we're going to make a visual assessment of the entire accident scene. Looking at it for a few things: the number of potential patients, the severity of their injuries, how much and what kind of help are you going to need. So use your initial radio report. We want to make sure we're kind of creating a verbal image. So we want to use clear language. We want to be concise, be calm. Don't shout. The really easy thing is to get wound up and shout on the microphone. Don't do that though. So we're going to have some key points that we need to communicate with dispatch. Some of these things are the location of the incident, the type of the incident, any hazards that people need to pay attention to, the approximate number of patients, and then what kind of assistance do you need? So, you know, I need an ALS ambulance. I need an ambulance out here that has paramedics on here because these guys are all broken up and they need medications and interventions and all of these kinds of things. Or what do you need? So be specific with your requests, as specific as you can anyways. So a good rule of thumb when we talk about this, request 1 ambulance for every 5 patients. So really what a lot of it comes down to is really following the protocols of your department when calling for additional resources. So when we talk about that, we want to determine the perimeters for the emergency vehicles only and exclude all other vehicles from that area. So we want to make sure that this area is for emergency vehicles only. And then we also want to establish a one-way route for emergency traffic to approach the scene and separate a one-way route for emergency traffic to exit the scene. A separate exit and a separate entrance, if at all possible. Sometimes you're not going to be able to do that depending upon your scene. So when you do call for additional resources, you want to do a couple of different things. So you want to make sure that there's enough room for these emergency vehicles that you're calling for to get up close to the scene where they need to be. So make sure that you're getting vehicles out of the way and you're not taking up, all the area. Keep vehicles and personnel who are not needed at the scene. They need to be in a staging area nearby. So casualty sorting. This is going to be the big piece that I was talking about earlier. So what a word that you're going to hear a lot if you're not aware of it is triage. And that's what we're going to be doing during this phase of this mass casualty incident. And this is casualty sorting or triage. And what that does is it kind of creates this order or it kind of creates some order, I guess, in a chaotic situation, is what I'm trying to say. So it allows us to kind of develop a system and move through and decide who needs care and who doesn't, and who's first and who's last, and all of those things. So what it is we're sorting these patients into groups according to their need of treatment. So the purpose of casualty sorting is to determine the order in which patients should be treated so that the most good can be done for the most people. Remember, just back up, rewind a little bit, and remember we talked about the most bang for the smallest buck, right? So that's what we're talking about. We want the sickest people to be taken care of, and we want to do the most good for these people that we can. So the thing when we talk about this, it needs to be about this casualty sorting system or a triage is it needs to be simple and fast. And it needs to be based on some skills and knowledge that you already possess, right? We don't need to start. This is not a place where we learn a new procedure as how to do this at this time, because that's not going to work. This is a very high, intense, anxiety-inducing event. So we don't want to have to learn something new. So we don't want to worry about diagnosing patients. What we're looking for is we're going to categorize, and we're going to do that quickly. And what we're doing kind of a system of these rapid and life-saving actions. So we don't want to stop during this assessment except to correct an airway and some severe bleedings, and it needs to be done quickly. So many EMS systems, they rely on a simple triage or rapid triage system, which is like START, if you've heard of that, because it's simple and it's easy to remember and it's easy to implement. So START lets EMRs triage each patient in 60 seconds or less. So you can get to a lot of people when you're doing 60 seconds or less for each patient. And what we're doing is we're looking for 3 primary categories: breathing, circulation, and mental status. So we're going to go into each one in a second, but think about that and remember that. So, it's not as easy as the ABCs, what we talk about, airway, breathing, circulation, but we're just changing things up a little bit, okay? So we're going to do breathing, circulation, and then mental status. So what we do is that what this does is this START triage system. It's designed to help rescuers find the most seriously injured patients, and the most seriously injured patients, they need to be treated first. So that's why we're trying to recognize them first. So triage tagging, and when we talk about these tags, you see these tags here, they have lots of little markings and all these pretty colors and stuff. But what that does is, if it's filled out properly, is it tells others what we've found. So patients are able to be tagged so other rescuers can easily recognize their triage level. So tagging uses colored surveyor's tape or colored paper tags, and it's based on the method determined by your local EMS system. So you see here's the tape we're talking about here, and then of course we have these tags. All right, now we're going to get into some EMR stuff here, so where it's going to really make a difference. Triage tagging. So priority 1, which is that red tag, it's for immediate care. Injuries are life-threatening. So if we look and say, oh, this person's going to die from this, there's a good chance they're going to die, that's going to be a red tag. Priority 2, yellow tag, urgent care, can delay up to 1 hour. Priority 3, green tag, or what we might call the walking wounded, they can be delayed up to 3 hours. And then priority 4, gray or black, they're dead or no care is required. So we'll talk about what makes up all of these different colors. So the first step in START is to get up and walk. So tell all the people who can get up and walk to move to a specific area. That lets you know who's really sick and who's not. So if the patients can get up and walk, they rarely have life-threatening injuries. Not all the time. It's very easy to get tricked when we say something like that. Don't get tricked. We still need to make sure that they don't. But more than likely, they do not have a life-threatening injury. So to make the situation more manageable, we want to ask those people who can walk to move away from the immediate rescue scene to a designated safe area. So these are going to be the people that we caught when you heard me say walking wounded. That's who these people are going to be. They are designated as a green tag. So the second step in START, begin where you stand. That's where we want to start. Is that don't go ahead and just go move 100 yards another direction. Start right where you're at. So move in an orderly and systematic manner through the remaining patients. So what we want to do is want to stop at each patient, provide a quick assessment, and then make sure we tag them. If you assess them but do not tag them, you might as well have not even assessed them because no one's going to know. So the stop should never take more than 1 minute, should take significantly less, and you want to find and tag the priority 1 patient, those requiring immediate attention. So examine these patients, correct any life-threatening airway and breathing problems, tag the patient with a red tag, and then you move on. We're not there to provide treatment. We're there to provide triage. So we're sorting through these people. So the START system is based on 3 observations: breathing, circulation, and mental status. So you see here, red, yellow, green, kind of an idea of what people look like. You know, this guy, he's not going anywhere. He's got a big wound, it looks like, to his chest. He has an extra kneecap, so really his kneecap should be up here, but this sucker's broken in half, so that's going to be a problem. Walking wounded, they're able to take themselves somewhere else. So make sure that we're getting these people in the right groups. Now, talking about, I know what you're saying. How do I know what group to put them in? You only barely talked about it. Let's talk a little bit more about it. So breathing. This is where it all starts. So patients with breathing rates of greater than 30 are tagged as priority 1 or immediate. So that's one of the things right away. Breathing rate greater than 30. So if they're breathing at less than 30, move on to circulation and mental status. If they're breathing at greater than 30, 30 or more, or 31 or more, then we want to red tag them. So if the patient is not breathing, you want to clear the mouth of any foreign matter. So we're talking about maybe it's dirt or who knows what there might be. We're going to talk about this like through it was a tornado. Okay, so we want to as you can imagine, there might be leaves or, my gosh, insulation and all kinds of stuff that could be clogging up someone's airway. So we want to open the airway. We want to clear the mouth of the foreign matter, just like you've learned. We want to position the patient to maintain the airway, and then if the patient breathes, we're going to go ahead and red tag them. So remember, 30 greater than 30 seconds, and then if they are not breathing, we're going to clear the mouth and tag them as red. Patients who need help maintaining an open airway, they're red tags. So if you're in doubt as to the patient's ability to breathe, they need to be a red tag, and then you move on. If the patient is not breathing and does not start breathing with a simple airway maneuver, they're going to be a black tag. Circulation we're talking about, we're going to move on to circulation. So that was breathing. Remember, 30 or greater than 30, and then not breathing, adjust it, clear the airway, adjust it. Either if they're breathing, it's a red tag. If not, it's a black tag, and we move on either way. So circulation. So what we're saying, circulation, what does that mean? So is the oxygen getting around everything? Because remember, that's the blood's purpose, is it's taking all the oxygen and nutrients and everything to the cells. So is the oxygen getting around? So the best field method for checking circulation is the patient's carotid pulse. If it's weak or irregular, we want to tag them red. If the carotid pulse or a radial pulse is present and strong, we want to move on to the mental status observation. So if we got a good strong carotid pulse or a radial pulse, so we're talking about the carotid pulse right up on the neck near the Adam's apple, or if we're talking about the radial pulse, that's the one down on the wrist, then we're going to move on to our mental status. Now, we want to treat patients with a weak carotid pulse for shock. So if they have a weak pulse on their Adam's apple area, we want to treat them for shock by elevating the legs to return as much blood possible to the brain, lungs, and heart. And what that's doing is using gravity, right? I apologize if this thing keeps getting louder and lower. I keep moving this microphone. So what we're doing is we're using gravity to help blood get pushed down to the core to help perfuse the brain, the lungs, the heart, all of those kind of things. So we want to get the patients to assist with controlling the bleeding or ask one of the walking wounded to help. So if they have a large, severe bleeding area, bloody area, we want to either have them apply direct pressure or have a walking wounded to apply direct pressure. You can't, remember, because you need to tag this person and move on. So if the carotid pulse is absent, guess what? Black tag, or sometimes some are gray, but you want to make sure that you're doing them right. So we talked about breathing. Now we moved on to circulation, and remember we said with circulation that if the patient is with the carotid pulse, if they have a strong carotid pulse or a radial pulse that is present, we want to move on and make sure that we treat them for shock. If it's absent, though, then we're going to black tag them. Now we're going to move on to mental status. So opening your eyes, that's what we're talking about is can they follow commands, all of those things. So that's what we're going to do. We're going to determine whether this patient responds to verbal stimuli. So whether they follow commands, whether when we prompt them they respond appropriately, all those things. So patients who can follow simple commands and have adequate breathing and adequate circulation, they're delayed. They're yellow tag, priority 2. So we want to tag unresponsive patients as priority 1. So if they didn't walk away already, they're not a green tag, a walking wounded, and then everything's okay, they're going to be a yellow tag. So to start, I'm sorry, I didn't click that button there. So START is designed, START it's just the beginning of this whole thing. So the START triage system is designed to help rescuers find the most seriously injured patients. So as more rescuers arrive, the patients will be retriaged for further evaluation, for treatment, for stabilization, transportation, all of those things. So each mass casualty scene should have a person designated as a triage officer. Many times that's going to be you, because you were the first to show up. So remember this about people, though. They don't always stay in the same condition. So they may seem to be stable now, and in 10 minutes they could decompensate and not be stable. Just like you. Your day starts out good, and then something happens, and it's not so pretty good. It's just like that. So everything doesn't always stay the same. Now, remember, when we talk, guys don't know a whole lot about shock, but what you do know, hopefully, you understand that it can continue and it can progress. So what I'm trying to tell you is some conditions can become more serious as time goes by. So if it is possible, go back and recheck the condition of priority 2 and priority 3 patients. Make sure, because what are we checking? We're going to make sure they did not become priority 1 patients. Excuse me. So, casualty sorting, you'll see here, start where you stand. So call out. We see walking, wounded, and uninjured. Minor, we're going to hold them in a specific location, usually kind of just over on the other side of your scene. But we call out, and for the non-walking, remember, we check for respirations. We talked about that, right? Yes, they are breathing, because no, we're not going to do much, but we'll hit that portion in a second. So respiration, yes, we drop down over here. Is it under 30 or over 30? If it's under 30, talking about respirations, then we move on to perfusion or circulation, right? This was breathing. It's probably should say breathing there so you understand that a bit better. And then circulation, we look for a radial pulse or a blanch test, which you can blanch the fingertips. So a radial pulse, is it absent or is it present? Let's say it's present, because absent, they go into immediate, right? They go into a red tag. If it's present, we go down to the mental status. We're going to look for mental status. Do they follow simple commands? If they do, they're delayed. If they do not follow simple commands, they're going to be immediate. So we're going to call them a red tag. So you're going to kind of probably need, looking at this algorithm, I'm sorry, this is the first time I've seen this algorithm built up like this. If we could, we should probably change some of these colors, right? So we would know immediate should probably be red. And then this delayed could be green, you know. And just think about these. These are going to be black, right? So make sure so you can just walk these out through your mind. Imagine one of your patients. Imagine a scene you've probably already been on, and how that person, and you just walk them down through here and decide where this is. These are also really good to create, like to print this thing off and keep in your bunker gear or in your pants, because then you can just pull that thing out, and in 5 seconds you can walk them right through there and determine what they are. So, working in a mass casualty incident. So, if you're not the first person to arrive at the scene of the MCI, you need to report to the incident commander before going to work. Don't freelance. Don't be that guy that just goes and jumps in the middle. It's really easy to do, especially with most of our personalities, our type A personalities. We're ready to jump in knee deep, but that's a problem. Hopefully there's some order to this chaos, and they'll be able to put you where they need you. So now if they just say, just go out there and find somebody and treat them, that's different, but don't initiate that. They hopefully have a plan. So the incident commander will assign you to an area where your help and skills can be best used. So an effective incident command system, or an ICS, this is the guy that, gets there, and he's going to probably be your chief, or maybe a captain or a major, depending on how your system is set up. But all of these things, that depend on the integrated, agreed upon protocols involving fire, law enforcement, and EMS. Everybody working as a big team. That's the important part. So if you're first on the scene, you're going to need to make that initial size up, right? We talked about that. You're going to clearly and accurately report the situation to the dispatcher, right? You're going to let them know where you're at, what's going on, and what we need to do. And then you're going to start your initial triage. So, as more highly trained people arrive at the scene, you want to accurately report your findings to the person in charge by noting some of these, or not a few of these, but noting these following information, these nuggets here. Approximate number of patients, the number of patients whom you have triaged into the 4 levels, and then additional assistance required, and then anything else that might be important. Maybe there's a hazardous material spill, or there had been a little fire, or somebody was fighting, and there's all kinds of issues and stuff. So those are the pieces that we want to work on. Now, NIMS. We said we're going to talk about the National Incident Management System, NIMS. Now, this was developed by the United States Department of Homeland Security. And what it was created for is to provide a consistent and unified approach to handling emergency incidents. If you don't get anything else from this part about NIMS, remember that, because that will get you through many NIMS classes. NIMS was developed for really a couple of little things, and what it is to provide a consistent and unified command or approach to handling emergency incidences. So that way you don't have 3 guys who think they were all in charge on the same scene. That's a big mess. So it's designed to effectively and efficiently handle the immediate response, the mitigation, the long-term recovery of small and massive natural and man-made incidences. So it's covering everything. You can use the NIMS system for a car crash on the highway where you need to bring in you're not going to use it if it's a one-car crash with one person. But if you got two or three cars, actually what we said earlier, right, the multiple casualties, you can use NIMS is built for that. So you don't have a bunch of different people walking around saying a bunch of different things. That's not good. Remember, at the end of the day, all of this stuff is built for our patients. We are here to take care of people, and that's what this is for. So NIMS, 5 major areas are addressed within the scope of NIMS. So you got preparedness, and I'm going to go left to right, communications and information management, resource management, command and management, and then ongoing management and maintenance. Now, you're not going to, in a smaller department or even a big department with small scenes, you're not going to see all of these different pieces, okay? But they do consider this ICS we talked about consists of 6 major features. So standardization, always the same, command, planning and organizational structure, facilities and resources, communications, information management, and then professionalism. So where do you fall? Maybe that's what you're wondering. EMRs fall within the first category. So they fall within the command and management component of NIMS. Now, the federal government requires many agencies to utilize NIMS. It's recommended that EMRs be certified in the following courses. So if you haven't, you might think about going to ICS, get your ICS 100. It's an introduction to ICS. It's a good idea. This is what we're talking about with these incident command systems. And then FEMA IS 700, and it's NIMS and introduction. So there's a lot of different things that I think you can get all of these on the FEMA website. Most of them, there's only a couple that even cost money, and you're able to do this at home, get you a certification, and it gets you exposed to much more information that will hopefully help you in the future. So terrorism awareness, we're shifting gears here. Terrorism is the systematic use of violence by a group, we're talking about a definition here, by a group to intimidate a population or government to achieve a goal. Maybe you've seen some of that lately. There's a lot of stuff going on like that where you have people that are shutting things down, you have people that are not allowing people to move about freely, all these different things, and it's to achieve a goal. So, you've probably seen some of this kind of stuff going on lately. So terrorist acts may be instigated by a country's citizens or people from other countries. And we're just talking about generalities here. So methods used to incite terror. Lots of different ways. Guns, explosives, fire, chemicals, viruses, bacteria, radiation. A lot of different stuff can incite terror. WMDs, weapons of mass destruction. So what are those? Well, the agents that are used by the terrorists are many of the same agents that produce hazards for EMRs and everyday accidents and investigations. So when we talk about WMDs, we're talking about any agent designed to bring about mass death, casualties, and or massive damage to property and infrastructure. Now it includes explosive, chemical, biological, even nuclear weapons. And currently, the preferred WMD to date has been explosive devices, so truck or car bombs or even pedestrian suicide bombers. Many previous terrorist attempts to use either chemical or biological weapons to their full capacity have been unsuccessful. And that's, to me, is kind of one of the most scariest things, because there's a lot of this stuff going on that we're not even aware of. Plans that are getting stopped and people getting caught that we're completely unaware of. So we've got to always be kind of on the ready, and just pay attention to where we're at and our scene. That scene awareness is going to be really important. So potential targets and risks. So to understand the threat that terrorists pose to people and places, we got to consider the places that terrorists might identify as a target. So a couple of things obviously stand out: bridges, tunnels, pipelines, harbors, stuff like that, national monuments, housing development, all kinds of stuff. Oops, I'm sorry, I hadn't clicked over. So here's a picture of obviously some things that you can expect that might be a potential target or risk. There's some ideas for you about terrorists. Between 01 and 13, we're looking at 3,000 deaths. Heart disease, though, 600,000 deaths. So maybe, there's something we might call a medical terrorist, somebody that's something out there that's giving people heart disease. So, agents and devices. So a wide variety of agents and devices can be used to incite terror. And so we talked about these: explosive, incendiary, chemical, radiological, biological. These all produce a concussion that destroy property, inflicts injury and death, and we're talking about explosives. Incendiary devices are designed to start fires. Pipe bomb is what you're seeing here. So some safety: if you're called to respond to an explosion, be alert for safety hazards that may have been created by the explosion or by a terrorist. So you don't want to enter into that area until it's made safe. Once we get the properly trained people there, that lets us know that it's safe. Be alert for the possibility of a second explosive device, and then use the same safety skills you developed for other types of emergency situations. You're not going to be able to enter the scene where the event has occurred, and you don't want to at a WMD. So, don't do that. Staging should occur upwind and uphill. Hopefully, if you haven't taken that hazmat class, you'll remember this, because that's a big key. You want to be upwind and uphill. You don't want that stuff blowing in your face or running down on your feet. So, chemical agents: you have pulmonary agents, gases that cause immediate distress and injury. Once these chemicals are inhaled, they right away start to damage lung tissues, and then you get pulmonary edema from that. So think about just some fluid in the lungs. Pulmonary agents can cause intense coughing, gasping, shortness of breath, all of these kinds of things. So we want to be pretty thoughtful about these. Metabolic agents, now, they affect the body's ability to use oxygen at the cellular level, so that's going to be a real problem. The most common metabolic agents, there's going to be, when we talk about this, it's going to be cyanides. They're produced in large quantities using gold and silver mining. They're used in photography, plastics processing, a lot of different stuff. But contact with cyanide produces shortness of breath, flushed skin, rapid heart rate, seizures, coma, cardiac arrest. That right there are a few of those things. I ought to tell you, it's bad stuff. Insecticides: they're a class of poisonous chemicals that are inhaled or absorbed to the skin. So many insecticides are organophosphates. What they do is, you might see, I believe, it's right up here. So you have this, what is it called? Acronym, I believe. But it's, so salivate, you're talking about sludge, right? That's what we're talking about, is or mnemonic maybe. I'm sorry, I should know that. But whatever the word is, the first letter of this word tells us all the signs and symptoms. So sludge, salivation and sweating, lacrimation or excessive tearing, urination, defecation, diarrhea, GI upset and some cramping, and then vomiting. So that's known as sludge. Far more emergency providers have experienced accidental contact with insecticides in routine calls than during terrorist-related events. This is not something totally uncommon in your career, that you might get some organophosphate exposure, or that you run on someone that has had a very large exposure to that's working on a farm or something. Chemical agents: so nerve agents, most among deadly chemicals developed. They can cause sludge-like symptoms. 4 of the most commonly mentioned nerve agents are sarin, soman, taboon, and V agent. So in an emergency situation, your primary responsibility is to keep yourself and other rescuers and bystanders from becoming contaminated. Remember, scene safety, your own personal safety, is going to be our utmost priority. So scene safety is going to be very important. A well-trained hazmat team and special protective equipment is needed to remove and decontaminate people and all of that with this stuff. Blister agents: they produce some burn-like blisters. You see pain, irritation, severe shortness of breath, severe coughing, all that kind of stuff. It includes sulfur, mustard, a lot of different things. So safety considerations when dealing with chemical agents: if multiple people are experiencing unexplained symptoms, you should suspect a common agent as the cause. Now, this is related but unrelated. We're not talking about weapons of mass destruction, but suppose you report to your local school or a local business, and everybody is feeling sick to their stomach, and people are becoming lethargic, so they're becoming drowsy and weak and all of that. If there's a group of 10 people that are all in the same building and they're all feeling that, that should be what you're thinking about, is some type of exposure. And here our first thought was, just like you say it was in the winter, our first thought would probably be carbon monoxide, right? Because that's some of the problems that it does, is it changes people's skin a little bit pinkish red, makes them short of breath, makes them tired, sick to their stomach, all those kind of things. So when you have my point is, when you have a large group like that and everybody starting to feel the same, you might think about some type of exposure. So your primary role is going to be to recognize that a problem exists and to avoid contaminating yourself. Again, right? Scene safety, other rescuers, and then other bystanders. So as we mentioned before, stay upwind, uphill and upwind from all of this stuff. Now here's the characteristics of chemical agents. I'll let you read through those. I'm not going to read them to you. Biologic agents. So biologic agents are naturally occurring substances that produce diseases. Now they can be bacteria such as anthrax or a plague, or viruses such as smallpox or hemorrhagic fever. So although biologic agents are hard to disperse so as to contaminate large numbers of people, they could be used as a deadly weapon by terrorists. So these things, they have an incubation period, talking about the diseases, which is the time from exposure to the disease organism to the time the person begins to show signs and symptoms of the disease. Now, if people were exposed to an infectious organism today, it might be several days. That's when we talk about this incubation period. It could be several days before they show signs and symptoms of this disease. So that's a real problem, because, somebody, it's not like they know the area that maybe they were exposed in. So the first awareness of biologic terrorist incident would likely come from the hospital emergency department and public health departments, because that's where people would start reporting. Safety considerations: be alert for unusual patterns of diseases with flu-like symptoms. Review your current information about disease trends provided by your medical doctor and public health department. Obviously, practice appropriate standard precautions. Now, what you're saying, appropriate standard precautions, I hope that's not what you're saying. But in the event you are, we're talking about PPE, personal protective equipment. So I always recommend that you make sure that when you're dealing with people, you wear gloves. Not just going to go have a conversation with them, but when you're going to get hands-on with somebody, especially with any type of body fluids, always have gloves on. And I recommend that you always wear gloves, because one of these days you're actually going to run into somebody that's sick, and you're going to be gloved up, and everything's going to have been done properly, and you're not going to have to worry about it. But if you don't have a good standard precautions practice, then when this time comes, you are going to be in trouble, because you're going to get exposed to this stuff very easily. Radiologic agents. Ionizing radiation is a kind of energy that is formed by the decay of a naturally occurring or human-made radioactive source. So these things, this is used everywhere: nuclear power plants, military weapons, hospitals, research facilities, all kinds of stuff. So exposure to excess amounts can cause delayed illnesses such as cancer. So this can go kind of one of these things that just keeps on going, right? Kind of like that bunny. Then we got radiological agents. We're still talking about those. It can't be seen, felt, detected with any of the normal body senses. So it's, we're not going to smell something or see something. Special instruments are needed to be able to detect and measure and all of that stuff. So, this is something that we just need to be thoughtful of. And finishing up, our response to a terrorist event. So emergency response personnel need to develop an all hazards approach for managing terrorist-related emergencies. So in all emergencies, the same safety rules apply, right? Good scene safety. I've said that at least 5 times. We're going to keep saying it. I'm going to harp on you about good scene safety till the end of this thing, which is very soon. Diligent use of standard precautions. So wearing your gloves. If you have a face shield, someone's hacking and coughing and all that kind of stuff, put a face shield on them. If you're with a patient waiting on an ambulance, or maybe you're transporting or whatever, and someone is hacking and coughing and all of that, put a mask on them. And I'm talking about like a non-rebreather mask. If you have a flu mask or whatever, that'd be fine too, that they can breathe through. But if not, put an oxygen mask on them, turn the oxygen on, make sure it's hooked to oxygen, turn the oxygen on, allow them to breathe that oxygen, and they won't hack all that stuff all over you. We don't need all those goobers and all that stuff flying through the air and hitting us and taking that junk home. Scene safety, right? Personal safety. So, you may have to, I always say this job is a lot more like MacGyver than anything else, because you have to see something and kind of work your way around it. Well, if someone's hacking and coughing and all of that, maybe you can't necessarily get out of the way because you're in the back of a rig with them, or you're standing right next to them. But you can put a mask on them to where if they do hack, it's going to be inside the mask. Sometimes people just spit too. Sometimes you get some nasty person that, they're mad about something and they'll spit on people. They're a perfect candidate for a mask. So back to this. Sorry about that little rant. So your response to terrorist events: be prepared and know the limits of your training. Understand, kind of know your role. Stay in your lane, right? Don't go worrying about treatment when you're just should be worried about triage. Don't try to do some advanced skill when you don't have the training or even the equipment to do it. So kind of stay in your lane, Many types of terrorist events require you to stay a certain distance away to avoid contaminating additional people. And then be alert for secondary devices placed by terrorists that are set to detonate after emergency responders arrive at the scene. And that's been the case a few times. Once again, ICS, right? Establish an incident command system ASAP, as soon as possible. And then know your role. We talked about staying in our lane. We need to know our role within that ICS. If I roll up on an ICS as a paramedic, I am not going to be the incident commander unless something weird happens, or unless I'm the first guy until somebody else comes along that can become the incident commander. That's not my role. So that's what whenever I say that, I don't mean that to sound derogatory or like be negative. What I'm saying is we need to know where we are and who we are and what we're there to do. We're not there to manage the scene. We're not there to treat and transport, unless that's what your job is. We're there at this point in this situation we've been talking about. We're there to triage, and that's what we're going to do. And we're going to focus on triaging and do a good job. So establish that incident command as soon as possible. Know your role in working within the ICS. Treat these incidences as a mass casualty situation. Always establish good working relationships with appropriate local, state, and federal agencies. And then, once again, guess what? Scene safety. Always be alert for your safety, the safety of rescuers, and the safety of your patients. Let's see what happens now. I went through there. There we go. That's what I was looking for. Forgot to click the slide a couple times. I'm sorry. That's it. That is Chapter 21, Incident Management. Couple of key notes as we talked about. ICS, triage, the START system, obviously. Know your role, know your lane. Those kind of things are going to be the most important that I can tell you through Chapter 21. So, thanks a lot for sticking with me, and we'll talk to you soon.